So thank you very much for the opportunity to chat to you today about some of the research we've been doing about health inequalities in left behind neighbourhoods, and I'll go on to explain exactly what this term means and what this might mean for wider economic growth and how inequalities in health might really hinder the government's levelling up agenda. I want to start by saying I think we should acknowledge that health is really important in its own right. It shouldn't just be seen as a vehicle for improving economic outcomes. But if there are positive spillovers, it's important to understand these and see how we can go about improving people's health, which will then have positive spillovers onto the wider economy. So the work I'm going to present today uses understanding society data as well as administrative data. And it was a piece of work commissioned by the all-party parliamentary group for Left Behind Neighbourhoods with some really great colleagues. I want to acknowledge those as well. So as I say, the all-party parliamentary group for Left Behind Neighbourhoods asked us to look at health inequalities in these left behind neighbourhoods and then examine what this meant for wider economic development. So a left behind neighbourhood is a term coined by the all-party parliamentary group, and these are neighbourhoods or wards that are in the most deprived 10% of communities nationally using the index of multiple deprivation, but they also have the highest 10% of needs on the community needs index. So what the Community Needs Index is some measure created by OXI, the Oxford Consultants for Social Inclusion, that looks at the facilities and the assets and the connectivity of neighbourhoods as well. So what the logic here is that deprivation is really important for people's health, but it interacts with the lack of resources people have to engage and feel they belong to their community and their neighbourhood. So it's this interaction of these two that we're really interested in. So left behind neighbourhoods are clustered. They are not spread across the country in an even way. So for example, there are 225 neighbourhoods in England. And I stress that we will focus on England here. As Raj said, there is devolved administrations in the other countries. So this is very much England specific. But there's 225 left behind neighbourhoods in England. But of those 225, 138 are in the north of England, with disproportionate amounts in communities such as County Durham, Greater Manchester, and Kingston upon Hull. So the 16 in County Durham, you compare that to there being only 3 in the whole southwest of the country. You can see there's big geographic inequality in the spatial patterns of these left behind neighbourhoods. And again, there is patterns which will be talked about later, looking at there's a lot of left behind neighbourhoods on the coast and in rural areas, and also in some ex-industrial communities in the north, particularly in the northeast of England. So what we want to do now is look at health inequalities in left behind neighbourhoods. So I think we know that there are big inequalities in England now, and these are being grown over time. They're not getting any smaller. So for example, if we look at life expectancy, we can see that left behind neighbourhoods have lower life expectancy than the English average, about 3 years for females and about 3.5 to 4 years for males. These gaps are even bigger, about 7.5 years when we look at healthy life expectancy. So it's the amount of time people can expect to be in good health. And then the chart on the right-hand side shows what's been happening to these inequalities over time. So here we need to look at local authorities that contain left behind neighbourhoods to get a time series. We can see that, if anything, these inequalities are actually getting bigger, and particularly in the 2010s. There's a lot of evidence to say that deprived communities in these left behind neighbourhoods were disproportionately affected by austerity measures. That led to a flattening out and even a decline in life expectancy in the mid-2010s. And that really comes out in these graphs here. So if anything, these inequalities have been getting bigger over time, and they're not getting any smaller. And this is a real cause of concern. We can look at lots of different health measures and metrics, and we'll get the same picture. So, for example, on the next slide, we have the prevalence of a number of common health conditions. And what we see is that left behind neighbourhoods have higher prevalences of almost all of these conditions than the English average. But left behind neighbourhoods also do worse in terms of the prevalence of conditions than equally deprived neighbourhoods, so neighbourhoods that are in the most deprived 10% nationally, but don't have high values of the Community Needs Index. And again, no matter which of these conditions we look at, you can see there's a strong social gradient with a couple of exceptions such as cancer and atrial fibrillation, dementia, and osteoporosis. But typically, the majority of these conditions are much more prevalent in left behind neighbourhoods. When the pandemic hit, we expected it to be inequalities because we know people's vulnerability and resilience had been eroded due to worse health leading up to the pandemic. But the size of some of these gaps was quite staggering. So this is just data from the first 12, 13 months of the pandemic. And you can see that there are big differences in the all-cause and the COVID-specific mortality rate between the English average and then left behind neighbourhoods. And again, left behind neighbourhoods do worse than equally deprived neighbourhoods that weren't left behind because they didn't have high community needs. Then using understanding society data, we wanted to see what was going on with people's mental health during the pandemic, because we know there were lots of factors that could contribute to worsening mental health during the pandemic. So we used a general health questionnaire, the 36-item GHQ, to look at mental health in the pandemic. And again, so we reverse coded the general health questionnaire so that higher values corresponded to better levels of mental health, 36 being the theoretical maximum. And again, there's a social gradient in mental health that we observed during the pandemic. So people living in left behind neighbourhoods in understand society reported on average lower mental health scores than the English average from understand society, and people living in deprived, non-left behind neighbourhoods. So not only was it worse during the pandemic, the inequalities had grown over time. So what we do here is we compared changes in mental health. So we looked at mental health in the pandemic period and compared that to the same people in the corresponding period in 2018 and 2019. And then the gap had grown in left behind neighbourhoods. So people in understand society living in left behind neighbourhoods experienced a bigger decrease in their mental health throughout the pandemic. So we combined lots of information from the ONS, what was Public Health England fingertips and Understanding Society, to create a health index, a composite measure of health at the local authority district level. We also used some of the variables in the ONS's health index, but this wasn't available for the latest period of time. So we basically tweaked that and incorporated some Understanding Society data. And again, here, the dark green areas correspond to the best possible health, the 20% of best possible health, and the lighter green or the cream areas correspond to the worst health. And you can see very strong evidence of spatial patterns. So there's lots of clusters of the worst health areas, and there's lots of clusters of the best health areas. And then we want to go on to do, which I'll talk about later, is look at how these correlate with economic outcomes in these areas as well. So what was going on in left behind neighbourhoods? So I think it's important to see what the position was before the pandemic, to see what was going on. So in 2019, the last available data we have pre-pandemic, there are big inequalities, there are big differences in annual salaries and annual gross pay in left behind neighbourhoods. So the annual salary was about £5,000 lower on average in a left behind neighbourhood than it was in the English average. And again, left behind neighbourhoods do worse than deprived but non-left behind neighbourhoods. This is consistent across males, females, and then the total. So there's again this gradient in this economic outcome when we use wage as the key outcome. Interestingly, there was a little bit of evidence to say that people in left behind neighbourhoods work slightly more hours on average, so 38 compared to just under 38. So this gap in wages couldn't be explained by different working patterns on average. However, what it could be explained by was a type of sectors that people in left behind neighbourhoods in. So this chart here shows the nine main standard occupational classifications using data from NOMIS and the ONS, but also supplemented with UKHLS, Understanding Society. And you can see the strong social gradients here. So people in left behind neighbourhoods are more likely to have employment in the higher SOCs, which correspond typically to the lower paid, the more manual and the blue collar type jobs, and they're much less likely to have jobs in the highest paying managerial and executive positions. So it's not hours work that's explaining this gap in wages, it's the type of jobs that are available and the occupations that locate in these left behind neighbourhoods. We can put all of these economic measures together to look at gross value added. So gross value added is essentially a subnational measure of gross domestic product. It can be thought of as a total value of economic resources produced in local authorities. So again, we're going to look at local authorities that contain left behind neighbourhoods and compare them to local authorities without left behind neighbourhoods. And you can see throughout the period 2010-11 onwards, left behind neighbourhoods has consistently had lower gross value added than places that don't have left behind neighbourhoods. And again, left behind neighbourhoods do worse than equally deprived but not left behind neighbourhoods. So in the latest figures, we use 2019 figures for gross value added. You can see these inequalities here. So on average, the gross value added in local authorities with a left behind neighbourhood was about 20,400 per person per year, compared to 28,500. So there's about an 8,000 difference in gross value added in local authorities that do and don't have left behind neighbourhoods. This is really important because these are the type of metrics that are used when we talk about levelling up parts of the UK. We want to improve economic performance. So then what we did was we looked at what possible association there might be between the health of areas and their economic performance measured by gross value added. So we ran a series of regression models, which I'll not include the specifics of here, but we account for lots of area level factors. We looked at fixed effects to look at within area changes. So we tried to isolate some of the unobserved factors of areas that might make a difference to their economic performance and their health that we couldn't observe. And then we included things that we could observe, such as their age, gender, ethnicity, lots of characteristics of the area. Then these are the coefficients. So the circle is a left behind local authority. The triangle is a local authority that is deprived but doesn't have left behind neighbourhoods. And then the square is the remaining local authority districts. So the confidence intervals do overlap, but there is again this gradient that there is a potential bigger effect of increased economic productivity by improving health in local authorities that contain left behind neighbourhoods. So if we increase the health index score by 1 standard deviation across the country, the biggest potential return is in local authorities that contain left behind neighbourhoods. We then looked at some decomposition analyses, so some statistical methods that allow us to decompose the gap in economic activity measured by gross value added into a number of different factors between areas, local authorities that do and do not contain left behind neighbourhoods. So the total value of the gap in productivity between local authorities that do and don't contain left behind neighbourhoods was about £124 billion. And then when we apply these Oaxaca-Blinder type decomposition methods, about a quarter of that, or just under 24% of the gap, was directly attributable to the worst health outcomes in these local authorities that contain left behind neighbourhoods. We need to be a little bit careful that we can't claim too much causality here. So we have looked at within area fixed effects, and this does account for those, but these decomposition methods don't really tend to lead to causal estimates. So I've used directly attributable here. I don't mean directly in a causal way. I mean, there is a direct association between worse health outcomes and worse economic outcomes. The direct effect is highlighted because we also include the level of education and skills in a local authority, and that accounts for quite a sizable proportion of the gap in economic productivity as well. And we know there's strong evidence of an association between health and education. So the idea is that health would affect education and skills. So health will have a direct effect on productivity by keeping people out of the labour market and getting people out of the labour market to provide care for friends and family. But it will also have an indirect on productivity through its effect on education and skills. So typically people in lower health are able to spend fewer years in education and getting skills. so they tend to have worse outcomes in terms of human capital formation. So if we apply 24% to that gap of 124 billion, it's just under 30 billion pound that of the gap in economic productivity that could potentially be closed if we improve the health outcomes of people living in left behind neighbourhoods. And just talking about some further work we're doing with the APPG using Understanding Society. So we're using this idea, so these are graphs taken from Understanding Society data, looking at mental health that falls below some acceptable threshold, and we term this mental health poverty, because people in these areas have mental health that is worse than is sort of clinically acceptable. And we look at the maps of the General Health Questionnaire, but also the short form 12 Mental Health Component Summary. There are strong spatial inequalities, and this maps almost perfectly onto where we find left behind neighbourhoods. And again, there's been a big increase in the prevalence of this mental health poverty between 2010 to 2020, with the biggest increases being found in left behind neighbourhoods. We've used administrative data on mental health conditions to supplement this, and we find an incredibly consistent picture. And again, we're working with the all-party parliamentary group to look at what happens to people using Understanding Society data when they move either in or out of a left-behind neighbourhood. Does that movement in or out of these left-behind neighbourhoods affect their health, which then subsequently goes on to affect their economic productivity? We're also trying to work out what characteristics of the left-behind neighbourhoods lead to worse health outcomes. So we know left-behind neighbourhoods, by definition, are in the most deprived 10% and have the highest community needs index. But are there other factors associated with worse health outcomes as well? And can we try and account for those and help shape policy recommendations to try and really improve the health of people living in left behind neighbourhoods, with the idea of the positive benefits of health being supplemented by the spillover effects onto economic productivity? So just to conclude, individuals living in left behind neighbourhoods have worse health outcomes and die much younger. They have fewer years in good health than people living in the rest of the country. And this is consistent across almost all health metrics in all data sets. So this is a genuine thing. We do need to intervene to try and improve the health and well-being of people in these left behind neighbourhoods. These people also typically have worse economic outcomes through no fault of their own. So they have lower pay, they work slightly more hours in blue-collar sectors and have slightly worse working conditions. And there is some statistical evidence of an association between these two. So if we do work to improve people's health, there can be positive spillover effects to the exchequer, generating increased productivity and reducing the gaps and helping us to level up. I think leveling up is an important strategy that the government needs to continue to take seriously, because these inequalities are incredibly entrenched, and unfortunately, evidence suggests they are growing over time. They're not shrinking. But as Raj said in the introduction, as we come out of the pandemic, we have the opportunity to really work on investing in health and public health, particularly preventative health rather than secondary healthcare prevention, to try and improve people's health, keep them out of hospitals in the first place, which we argue will improve their health directly and improve their quality of life directly, but will also improve their economic conditions, both of themselves and of the wider community. So thank you very much. That's all I have to say on this topic.